The coronavirus continues to affect every area of life, but to some, it could be more serious than for others. It could actually be life or death. Kaila and Isaac's 11-month-old baby boy is waiting to see if his doctors will have the capacity to perform the surgery he needs as the medical community is overwhelmed with trying to deal with the current pandemic. They're joining us from Colorado. Also joining us is Dr. Daniel Amen, who is really focused on us taking care of ourselves mentally and emotionally during this difficult time of isolation. And Dr. Amen, I know you've been listening to what I've been talking about with Kaila and Isaac, and Robin is always want to say that you've got to take care of yourself so you can take care of others. And Dr. Amen, this is something that these two parents owe it to their children to take good care of mom and dad during this difficult time. What's the most important thing they can do to make sure that happens?
Well, I'm so sorry for your job loss, for the stress. I have a granddaughter who's handicapped and has a severe seizure disorder, and there's just nothing worse. And so, one, acknowledge it's hard. But two, just like Robin and Dr. Phil said, if you don't take care of yourself, you are not going to be able to be there in a good way for all of the children. So this is the most important time in your life to practice mental hygiene, which means sleep is critical. And when you can't, there's all sorts of great strategies to help you sleep. And one of my favorite ones is have a journal by your bed. And so when you have a worry that goes around 3 times, write it down and then write down what you can do about it and what you can't do about it. And focusing on what you can do will help you so much. Be very careful not to catastrophize what we talked about earlier, because
Mhm.
now, unless it's an emergency, you don't want him to have the surgery at a time when everybody's infected and everybody's stressed and the surgeons are completely stressed out. You
Yeah.
want to give it some space so that things can get back to normal, and hopefully sometime soon that will happen. Feeding right, but you're going to have more influence over the other 4 children than at any other time in their lives. And so being a good model, practicing this sort of clean way of thinking will help them so much.
There's a difference between blame and responsibility. And my question is, have y'all sat down and talked to each other and acknowledged, look, this is a tough situation and our child's in a tough situation, but we didn't do anything wrong to create this situation. There's no room for guilt in our lives here. We shouldn't be beating ourselves up over this because we didn't do anything wrong. We didn't bring on this
Right.
pandemic. We didn't bring on this medical challenge that we have with our child. I mean, have you guys actually said out loud, we did not create this situation? There's no room for guilt here.
I don't think that we've actually talked about that, but we've known about, like we've thought about it, I think, to ourselves, but we actually haven't sat down and talked about that because for the longest I had a lot of blame. I blame myself. Um,
But how important is that, Robin? I mean, from particularly from a mother's standpoint, to give voice to the fact that you didn't create this, you don't own it, but you are going to manage it.
I think it's so very, very important because as a mother and a woman, I think we can both relate to that mom guilt in every situation, but especially when our child is suffering.